Hello everyone. So today in this video we are going to discuss about the anti-epileptic drug. So first before that we have to know that what is epilepsy. What do we mean by epilepsy? So as the epilepsy, it is characterized by the seizures. So when we have seizure is when there is overstimulation of brain. When brain is overstimulated, then it leads to the seizures. So, and epilepsy is characterized by the seizures. So now we have to depress the brain. So the epilepsy means we have to give the anti-epileptic drug. Means we have to depress the brain, because first there is overstimulated and which lead to the seizure. So we have to depress the brain so seizure will not occur. So how we can depress? So depress the brain. So when we depress our brain, those drugs which depress the brain, those drugs were known as anti-epileptic drugs. Anti-epileptic drugs. So in the anti-epileptic drugs, so here in the anti-epileptic drugs we have like which some drugs have the excitatory neurotransmitter and some have inhibitory neurotransmitters. So like GABA. So GABA is a inhibitory neurotransmitter. So if we increase the GABA, then that will depress the brain because it is an inhibitory neurotransmitter. So GABA is an inhibitory neurotransmitter. So we have to increase it so we can depress our brain. Second one, there is a glutamate. So glutamate is an excitatory neurotransmitter. So for epilepsy, we have to depress the brain. So it means we have to decrease the glutamate. So we have to decrease the glutamate neurotransmitter. And the sodium channel blocker we have to give. Sodium channel blocker, calcium channel blocker. And also we have to give the potassium channel opener. So our anti-epileptic drugs were based on these 5 categories. Some drugs increase the GABA activity, some decrease the glutamate, some drugs decrease the sodium blocker, increase sodium blocker. They are calcium channel blocker, and some were potassium channel opener. Now, how the GABA will act and how it will release. So suppose this is one end of the neurotransmitters. Here, this is a neurons. Here is GABA is stored. So first GABA has to come out from the vesicles. So suppose this is a GABA in the presynaptics. So when the GABA is released outside, it is degraded by the enzyme. That enzyme is transaminase. So GABA is degraded by an enzyme that is transaminase, and GABA activity will decrease. Second, there is a reuptake of GABA by the neurotransmitter. So there is a reuptake of GABA, and the second and the last one is when this GABA will act on the postsynaptic vesicle. So here is the postsynaptic. So on these 4 categories, first one is the release of GABA. We have to increase the GABA release so that GABA quantity will increase, and we have to inhibit this enzyme to increase the GABA activity, and also we have to inhibit this GABA transporter, and the name of this GABA transporter is GAT1. It's GAT1. So we have to inhibit this transporter, and also we have to increase the postsynaptically activity of the GABA, so that GABA will increase and it will depress the brain. So now which drugs will act on which type? So here I am writing the first one, that is the release of GABA. So first drugs were the drugs which release GABA. That is the first one, this one. So in this we have 2 drugs. The name of these drugs were pregabalin and gabapentin. So these 2 drugs were the drug which increases the release of GABA. So these 2 drugs, those were the pregabalin and gabapentin. Gabapentin. And these 2 drugs were the drug of choice. So these 2 drugs were the drug of choice for the neuropathic pain. Means these drugs were used in the diabetic neuropathy and the post-herpetic neuralgia. So if someone will ask you which drug is used for post-herpetic neuralgia or diabetic neuropathy, so the answer is pregabalin and gabapentin, because these 2 drugs are the drug of choice for the neuropathic pain. So here please remember, these were the drug of choice. So pregabalin and gabapentin, how they will act? So pregabalin and gabapentin, these drugs basically act by blocking the calcium channel. These drugs act by blocking, because when the calcium channel will block, there is no release of presynaptic vesicles, so there is no release of GABA. So we have to block that calcium channel so that there will release of these presynaptic vesicles will occur. So we have to block these drugs were blocking the calcium channel. So this is the first category in which we have to increase the release of GABA from the presynaptic vesicles. Now the second one, that is we have to inhibit the transaminase enzyme so that GABA will not get degraded and its activity will increase. So the second category in which is the second category in which we have the activity of transaminase, means inhibit GABA transaminase, inhibit GABA transaminase. And for this we have one drug. The name of that drug is V-gabatrin. That drug name is V-gabatrin. V-gabatrin means that transaminase inhibitor drug. So how we can remember this drug? TR represent the transaminase. IN stands here for inhibitor. And GABA stands for GABA. So GABA transaminase inhibitor, that the drug name is V-gabatrin, means suffix is trin, gabatrin. So, and this has side effect, and the side effect, how we can remember? We can remember the side effect by VI. This is a side effect, that is the visual field contraction is there. It causes the visual field contraction. So now this V-gabatrin drug, it is used for, so for which purpose V-gabatrin is used? So it is used for treatment of infantile spasm. So please remember that it is used for infantile spasm. And for this it is the drug of choice. So it is drug of choice for ACTH. Please remember that it is drug of choice for ACTH, that is V-gabatrin. So V-gabatrin is drug of choice for infantile spasm plus tuberous sclerosis. So these were the, so V-gabatrin is the drug of choice for infantile spasm plus tubular sclerosis. So it is the drug of choice for these two purposes, that is infantile spasm and tuberous sclerosis. So drug of choice is V-gabatrin. Now the third one, so for the third one we have to inhibit this GAT1. So how we can inhibit this GAT1? So here we have to inhibit this GAT1. How we can inhibit? So we have to inhibit the reuptake. We have to inhibit reuptake of GABA. That is, we have to inhibit the GAT1. So we have to inhibit the GAT1, and how we can remember this drug? So we can remember this drug by tiagabine. Please remember tiagabine. So T stands for GAT. So this, it becomes like GAT. And this one represents the one. So GAT1, IN stands for inhibitor. So this drug is GAT1 inhibitor, that is tiagabine. Now the fourth drug, so the fourth drug which drugs acting on the channels, and it act on the postsynaptic receptors, and it increases the GABA activity. So drugs acting on the channel. So drugs acting on channel. So which drugs were acting on the channels? For this we have drug barbiturate and benzodiazepine. Please remember barbiturate. And the other one is the benzodiazepine. And in barbiturate we have the drug name, that is the phenobarbiturate. So this phenobarbiturate, it causes hyperkinesia in the children. Please remember that it causes the hyperkinesia, means overactivity in children. Hyperkinesia. It is used in hyperkinesia children. In those children who have the hyperactivity, in those children we can give phenobarbiturate. In the benzodiazepine, we have so many drugs like the diazepam. We have another drug, lorazepam. We have the another drug, that is clonazepam. We have the other drug, clobazepam. Diazepam, lorazepam, clonazepam, and clobazepam. So for this, diazepam is drug of choice for the febrile seizure. For febrile seizure, the drug of choice is diazepam, and the drug of choice for status epilepticus is lorazepam. Status epilepticus. The drug of choice is lorazepam. And clonazepam, this drug is useful in absence seizure. It is useful in absence seizure. While the clobazepam, it is used in Lennox-Gastaut syndrome. It is used in Lennox-Gastaut syndrome. So clobazepam is used in Lennox-Gastaut syndrome, clonazepam is useful in absence seizure, while the drug of choice for lorazepam is the drug of choice for status epilepticus, and diazepam is the drug of choice for the febrile seizures. Now the other receptor that is the glutamate receptor. So in the epilepsy there is a hyperactivity of the brain, so we have to depress that activity. For depressing the activity means we have to depress the excitatory neurotransmitter, and our excitatory neurotransmitter is glutamate. So we have to inhibit this neurotransmitter, that is glutamate, means we have to decrease its activity, that is glutamate. We have to decrease the glutamate. So how we can decrease the glutamate? We can decrease by two ways. First, we can give the AMPA blocker, or we can give the NMDA receptor blocker, or AMPA blocker. So for AMPA blocker, we have drug in which AMPA will come, that is perampanil. So in perampanil, AMPA is there, so it represents that it is AMPA blocker, perampanil. And for the NMDA blocker, we have the drug that is felbamate, So felbamate and perampanil. Perampanil is also indicated in the focal seizure, perampanil, while for felbamate, it causes the side effect, that is bone marrow suppression. Felbamate causes the bone marrow suppression. Now the other receptor, that after the glutamate receptor, we have the third one receptor, that is we have to block the calcium channel and we have to block the sodium channel. So for the calcium channel blocker, we have T-type calcium channel blocker. We have to block the T-type calcium channel. So T-type calcium channel blocker, the drug name is ethosuximide. So ethosuximide. So in this drug, we can remember that success is there when we have to we didn't miss any class, means we did not absent. So absence cause success, absent does not cause success. So for this, it is only and only, means it is used only in absence seizure. So for the absence seizure, means absence means success. So means ethosuximide. And this drug has the narrow spectrum. Ethosuximide has narrow spectrum. Now the other neurotransmitter, that is the fourth one, that is sodium channel blocker. So for the blocker of sodium channel blocker, we have drugs like phenytoin, carbamazepine, oxcarbazepine, topiramate. We have the zonisamide. We have the lacosamide, and rufinamide. These drugs were the sodium channel blocker: phenytoin, carbamazepine, oxcarbazepine, topiramate, zonisamide, lacosamide, and rufinamide. Now for the side effects, we have to remember for the topiramate, we have the side effects, and we can remember it by comb, by the mnemonic comb. So comb is the mnemonic for the side effect of the topiramate, and it is means it causes these side effects, and the side effects like it decrease the alcohol craving, alcohol. It causes the weight loss, and this is the only drug which causes the weight loss. So it is topiramate were used in these patients like to decrease the alcohol craving, to decrease the weight loss, and it is the only epileptics which is causing the weight loss. Please remember, it is the only epileptic which causing weight loss, that is the topiramate. Next one is the M stands for migraine prophylaxis. It is also given in migraine prophylaxis, and for the bipolar disorder, also we can use the topiramate. But for bipolar disorder, the drug of choice is lithium, but we can also use the topiramate. Now topiramate and zonisamide, please remember that topiramate and zonisamide, these drugs causes the renal stone. These causes renal stones. While lacosamide and rufinamide, these were used in focal seizures, and while these drugs were useful in GTCS, that is generalized tonic-clonic seizure plus focal seizure. These drugs we can use the phenytoin and carbamazepine, but these drugs are contraindicated in absence and myoclonic seizure. Please remember that these drugs were contraindicated in absence and myoclonic seizure. In absence seizure, we can use the ethosuximide. Now, about the carbamazepine and about phenytoin, I have to some more points. So here I am telling you about the carbamazepine. So for the carbamazepine, we can also write it by CBZ, that is carbamazepine. carbamazepine. So this drug is the drug of choice for trigeminal neuralgia. So it is the drug of choice for trigeminal neuralgia plus focal seizures. And please remember, this is used in focal seizure in elder patient, not in the children. So for the elderly person, we can we can't use this drug in elder person. So in elder person, we will not use this drug, that is carbamazepine. Now it can be used in diabetes insipidus and bipolar disorder. So these drugs can be used in diabetes insipidus and bipolar disorder. But if someone asks you that what is the drug of choice for bipolar disorder and diabetes insipidus, so for the bipolar disorder, the drug of choice is lithium. And for the diabetes insipidus, we have the drug of choice, that is desmopressin. Desmopressin is the drug of choice for diabetes insipidus. Now, what were the adverse effect of carbamazepine? So, as in the words carbamazepine, loads of time A is coming. See, carbamazepine, A is there. So, for the adverse effect, we have the mnemonic, that is A. Means so many A's are there for the adverse effect of the carbamazepine. Those were A, and A. A stands for the autoinduction. Means it starts with low dose and then we have to increase the dose. And another A is for aplastic anemia. It causes the aplastic anemia. It also increases the antidiuretic hormone release from the posterior pituitary, and it only retain water. So there is dilutional hyponatremia is there. So we have to avoid this drug in elderly people. So because it causes the decreased sodium level, so we have to, it causes dilutional hyponatremia. So dilutional hyponatremia is caused by carbamazepine drug. So we have to avoid in elder person. That's why in the focal seizure in elder person, we didn't give carbamazepine. I will tell you which drug we will give. In the ataxia, it also causes the ataxia. Ataxia here stands for the nystagmus and vertigo. Nystagmus and vertigo. It causes the adverse effect, that is nystagmus and vertigo. Now the other drug, that is the phenytoin, which is also a sodium channel blocker. So for the phenytoin, we have to remember here O and this P. So here P stands for the powerful enzyme inducer, means this drug is a powerful enzyme inducer drug. And it also has the zero order kinetic. Please remember, it has the zero order kinetic, and this question asked so many times. So please remember it, zero order kinetic is followed by phenytoin drug. And it is also used for arrhythmic treatment like GTCS and focal seizure, as I already tell above, that it is used in GTCS plus focal seizure persons, and it is contraindicated in absence and myoclonic seizure. So now the adverse effect of phenytoin, we have adverse effect of phenytoin drug. So for the adverse effect of phenytoin drug, we have the mnemonic, that is hot malika. So in which H stands for hirsutism. It causes the hirsutism, hypertrophy of the gums, O stands for osteomalacia. It decreases the vitamin D. T stands for teratogenicity. Means it causes, in teratogenesis especially, it causes the fetal Hydantoin syndrome. M stands for megaloblastic anemia. A stands for arrhythmia. L stands for lymphadenopathy. It causes the lymphadenopathy. Insulin deficiency. It also causes the vitamin K deficiency. And it also leads to ataxia. So these were the side effects. So for the vitamin K deficiency, at the time of delivery, hemorrhagic disease of newborn will occur. So in pregnancy, we have to give the supplementation. If the female is on phenytoin drug, we have to give the vitamin K supplementation. Otherwise, the baby will develop hemolytic disease of newborn. So, and what type of teratogenicity it causes? Fetal Hydantoin syndrome. This is a previous year question, and with it also causes the hemolytic disease of newborn. This is also a previous year question. Now, after the sodium channel blocker, the fifth one, we have the potassium channel opener, because potassium channel increases the activity, decreases the because it depresses the brain. So fifth one is the potassium channel opener drug. We have to give the potassium channel opener drug, and in this we have one drug, that is the retigabine, or we can say ezogabine. I remember it like reti and easy se do retigabine. So this is the treatment of choice for focal seizure. It is a treatment of focal seizure, and this is the some other drugs. We also have some other drugs except these drugs. We have some other drugs like sodium valproate. So for the sodium valproate drug, it causes calcium channel blocker, sodium channel blocker. It increases the GABA activity and it decreases the glutamate, except it did not cause the potassium channel opener. It is not a potassium channel opener, except potassium channel. It depresses the brain by acting on various receptors, like it is a sodium channel blocker, calcium channel blocker, increase GABA activity. It decreases the glutamate. So this drug have broad spectrum. It is a broad spectrum drug, and it is this drug is a drug of choice. So sodium valproate is a drug of choice for GTCS, absence seizure, myoclonic atonic seizure, Lennox Gastaut syndrome, in which we are giving the clobazepam. It is also used in a drug of choice for Lennox Gastaut syndrome, and it is also used in bipolar disorder. But the drug of choice for bipolar disorder is lithium. Please remember that one. So sodium valproate and bipolar disorder. So what were the side effects of this valproate? So sodium valproate, the adverse effects, we can remember it by name, valproate. So TE stands for teratogenicity, which is most teratogenic drug is the sodium valproate. So it is the most teratogenic drug. Please remember, it is the most teratogenic drug. V stands for the vomiting. A stands for alopecia, or we can say curling of hair. L stands for liver, means it causes the hepatotoxic in young children. It is hepatotoxic to young children. P stands for pancreatitis, polycystic ovarian disease. R stands for rash, it causes the rash. O stands for obesity, means it increases the weight. But there is one drug which decreases the weight gain, means weight loss. It is helpful in weight loss. That drug is the Topiramate. And A stands for the ataxia. Except the sodium valproate, we have another drug, that is the lamotrizine. So I told that carbamazepine is not given in focal seizure in the elder person, but this drug it is a drug of choice for the focal seizure in elderly persons, because lamotrizine is not given in elderly person. So this drug is given in elderly person, and it has side adverse effect, and in adverse effect it causes the Stevens-Johnson syndrome, or it also causes the toxic epidermal necrolysis. Now there were some new anti-epileptic drugs. So new anti-epileptic drugs. So in the new anti-epileptic drugs, we have like one is the SV2A, because it's act on the synaptic vesicles, and these drugs were named the levetiracetam and brivaracetam. These two drugs bind to the SV2A synaptic vesicle proteins, and it depresses the brain. Next drug acts on the next drug is a cannabidiol, means it is derived from the cannabinoid receptor. So cannabinoid receptor, and it is directly obtained from the plants. So obtained directly from plants, and it is treat the Dravet syndrome. Now the third drug, that is the steripental drug, which increases the GABA activity, and it inhibits the lactate dehydrogenase enzyme, and it is also helpful in treatment of Dravet syndrome. So two drugs, cannabidiol and stilpental, helpful in the Dravet syndrome. Now the next one. So in the next one we have if some pregnant female in pregnancy, in the epilepsy in pregnancy, we can give which drugs we can give if the female is pregnant. So epilepsy in pregnancy, pregnant female, which drugs we can give? So for them we can give valproate. This is a most teratogenic drug, but we can give valproate, lamotrigine, or levetiracetam, which act on the SV2A receptors. And if there is seizure in eclampsia patient, which drugs we can give? So the drug of choice is magnesium sulfate, which we give intravenous route, IV route we can give, and it gives the protection against the neurons in baby. So protection, neuronal protection in baby. So all these were the anti-epileptic drugs. I hope this video is very useful for you guys. Thank you. Bye bye.